Hi, I'm Dr. Todd Ivan, one of the psychiatrists at Summa Health and present director of interventional psychiatry at Summa. I want to introduce you to the BrainsWay Deep TMS device that's used for major depression and obsessive compulsive disorder. Now with me we have a patient who I'm going to show you how we position folks and introduce what a typical treatment looks like. So patients come in, sit comfortably in this chair, we give them a cap that has a grid. We take the magnet that is under this cowling and position it initially, and tip back on the head. And then me with this wonderful foot pedal, I kind of just tap it a little bit, and we set a pulse to the magnet. And what we're watching for, and we're watching that right hand first session, we look for twitching. After we achieve twitching and find that level of energy to the magnets that makes the twitch happen half of the time, we then shift our helmet forward, deeper onto the head, secure all the straps, and then begin the pulses that are going to stimulate the brain. Those pulses happen at a frequency of about 18 per second for 2-second bursts, followed by 20-second pauses. You get about 3,000 pulses for treatment. The whole treatment takes about 20 minutes. Patients bring themselves to treatment, and after the treatment are none the worse for wear. They then can leave, drive themselves home. Often our patients go back to their workplace. Now, again, as I said, we do these treatments Monday through Friday. You get weekends off. It takes about 7 weeks for a depression treatment to be complete. With our OCD device, which I'll keep right over here, similar kind of mapping process. Again, we drop it onto the head and make the person twitch, then move it forward for the treatment position itself. With a patient who has OCD, what we're also going to do is take down a list of the things they worry about the most or the compulsive behaviors that trouble them most significantly. Then right before we stimulate, we're going to ask them a question like, did you actually close your garage? Or have you washed your hands since you came into the office? That is supposed to stimulate some worry. The device is then going to stimulate a region of the brain that helps to quash down the worries. And when patients come for those treatments, the treatment takes about 18 minutes. They have 29 treatments on that Monday through Friday basis, wrapping up in just under 7 days.